Today our topic is critical situations, epileptic fit and its appearance.
What is epileptic seizure? An epileptic seizure is a period of symptoms due to abnormally excessive or synchronous neuroactivity in the brain. Outward effects vary from uncontrolled shaking movements involving much of the body with loss of consciousness, to shaking movements involving only part of the body with variable levels of consciousness, to subtle momentary loss of awareness. Most of the time, this episode lasts less than 2 minutes and it takes some time to return to normal.
So there are several types of epileptic seizure. Each of them is different, and so we should help them differently. First, I'm going to tell you about focal impaired awareness seizures, which were previously called as complex partial seizures. Focal impaired awareness seizures affect a bigger part of one side of the brain than focal aware seizures. The person's consciousness is affected and they may be confused. They might be able to hear you, but not feel understand what you say, or be able to respond to you. They may not react as they would normally, and if you speak loudly to them, they may think that you are being aggressive, and so they may react aggressively towards you.
How to help them? Do not restrain the person, as this may upset or confuse them. Gently guide them away from any danger, for example, from walking into the road. Speak gently and calmly, as they may be confused. If you speak loudly or grab them, they might not understand and get upset or respond aggressively. After feed, they may feel tired and want to sleep. It might be helpful to remind them where they are. Stay with them until they recover and can safely return to what they been doing before. Some people recover quickly, but others may take longer to feel back to normal again.
Focal to bilateral tonic-clonic seizures. Sometimes a focal seizure spreads to affect both sides of the brain. This is called a focal to bilateral tonic-clonic seizure. Some people call the focal seizure an aura or warning, as it warns them that a tonic-clonic seizure may fall. How to help? If you or the person is aware of a warning, they may need help to get to a safe place before the tonic-clonic seizure happens.
Tonic seizures. In a tonic seizure or drop attack, the person's muscles suddenly relax and they become floppy. If they are standing, they often fall, usually forwards, and may injure the front of their head or face. Like tonic seizures, atonic seizures tend to be brief and happen without warning. With both tonic and atonic seizures, people usually recover quickly, apart from possible injuries. How to help? Reassuring them may be helpful. If they are injured, they may need medical help.
But what we usually associate with the epilepsy is a tonic-clonic seizure. So at the start of this seizure, the person becomes unconscious, their body goes stiff, and if they are standing up, they usually fall backwards. They may cry out, and they may bite their tongue or cheek. So during the seizure, they jerk and shake. They have convulsions as their muscles relax and tighten rhythmically. Their breathing may be affected and become difficult or sound too noisy. Their skin may change color. Their skin may change color and become very pale, and they may wet themselves. And after the seizure ends, their breathing and color return to normal, but they may feel tired, confused, have a headache, or want to sleep.
How to help during the seizure? Check the time to see how long the seizure lasts, because there may be a risk of status epilepticus. See below. Only move the person if they are in a dangerous place, for example in a road. Instead, move any objects away from them, so that they don't hurt themselves. Put something soft under their head, or cut their head in your hands, to stop it hitting the ground. Do not hold them down, allow the seizure to happen. Do not put anything in their mouths, they will not swallow their tongue. Try to stop other people crowding around.
So how to help these people if their once shaking stops? First of all, gently roll them into the side into the recovery position. If their breathing sounds difficult or noisy, gently open their mouths to check that nothing is blocking their airway, so they can breathe. Wipe away any spit from their mouth and try to minimize any embarrassment. If they have wet themselves, deal with it as privately as possible. And generally stay with them until they have fully recovered. They may need some gentle reassurance after the seizure.
Thank you for attention.